abstinence and waiting for marriage. And one of the best things that you could give your spouse is yourself.
Hmm.
And every time that you have relations with somebody else, you're giving them a piece of your soul, literally, and it just tears away at you psychologically. And to me, that's one of the sadder things, because it's important to talk about the things on the forefront. They're the obvious ones, but the ones that aren't so obvious is these psychological effects too. So
Hmm.
I think your position on parental involvement is so important, and I appreciate your stance there.
It's been an interesting dialogue, if you will, with constituents in the valley.
Hmm.
I think most people understand at a base level that as a youth sports coach, I always tease that I've coached both women's teams and men's teams as in the younger age groups, and I've noticed that it's the same with patients that they are pretty much not concerned. The adults, they trust me to take care of them, and then that we're going to get through it. But they let it be known, as same on the sports field, that you can do anything you want to me, but if you harm my child, I'll
Hmm.
remember you forever.
Hmm.
And I think this issue has tapped into a little bit of the mama bear with claws,
Yeah,
because they are the most important thing for all of us.
absolutely. And I want to commend the moms out there, because I think that moms are doing a better job than the dads about really getting involved. And I think it's that mama bear instinct to protect their kids. And I
Hmm.
think as men, we need to do a better job to get involved and listen to those mama bear instincts and raise our voices. And I know that, we go to work and we provide and we should be the protectors, but this is part of that layer of protection.
Hmm.
The last thing I was going to say, just on this position on the sexualization of our kids in society, we do have a large amount of adults addicted to pornography. And
Yeah.
that's something that gets pushed under the rug so often. And to me, that's what comes out of this desensitization. You
Yeah.
crave more and more and more. And there is literally there's groups in a lot of the churches around the country designed just to help men and women with pornography addictions. And it's a major problem that most people are not aware of.
Agreed. And to build on that, just as another component of law enforcement, I've spoken with Sheriff Hino this past year
Hmm.
and tried to understand some of the issues that were presented to him as escalating problems.
Hmm.
And although the human trafficking is an issue, the one that was even bigger was child pornography.
Hmm.
And it's because you can multiply one session through a major media platform and reach much farther.
Sure.
So it is the entry point for the issues that we're all trying to fight as this valley deals with growth, and we're all border states now.
Yeah, we are. Well, there's certainly a lot of nasty habits out there that people choose to sweep under the rug. I want to hear your position on healthcare freedom and some of the things that we've dealt with the last couple of years and how you're going to combat that, or what your position is on that.
Absolutely. And with regard to the healthcare freedom, I think we've seen over the last several years that the governmental agencies overreach in what they feel that they can dictate to the populace
Hmm.
and control your life, I think has been unconstitutional, number one, and oftentimes not backed up by data. I feel that both the CDC and the FDA have compromised their legitimacy during this pandemic. In addition to governmental agencies that either didn't know or refused to divulge information that was crucial for us to make decisions, from wearing masks and the effectiveness of those, depending on the type, and also the medications or the inhibiting of use of medications that are FDA approved.
Hmm.
So my thoughts going forward on that is to come up with legislation that would protect the provider-patient relationship with regard to informed consent and utilization of whatever medications and treatments were available and FDA approved, regardless of the condition that we were trying to address.
Hmm.
We can obviously, the quick examples come are ivermectin and hydroxychloroquine,
Hmm.
and their effectiveness in many other countries that was either suppressed or just ignored. Ivermectin is a better treatment and it costs $3 or $4 versus $3,000 for remdesivir.
Mm-hmm.
So, and it takes 5 days in the hospital to administer it. So there's perverse incentives and unintended consequences with some of these treatment plans to run up the cost, and those things are unacceptable.
I've got 45 animals on my property, and that ivermectin does miracles for every single one of them.
Well, as you know, the men that, I believe it was 2 men, got Nobel Prizes for inventing it.
Mm-hmm.
And it attacks many more spots on the COVID-19 virus than just one spike protein, which I believe is where the remdesivir acts. So the ability for a virus to mutate around that one blockage is much more likely than several parts of their replication process, which the ivermectin gets involved blocking. So it's also less likely to become one of those, like the antibiotics that are no longer effective after a bacteria has seen them for a while because it mutates a way around it.
Yeah. So I have a very serious question for you as it relates to, choices that we make. When COVID struck the country and struck Flathead County here where we live, we were all fearful. And I know some decisions were made across the board, whether that's, county commissioners or health board or et cetera. I think that after we realized within a few short weeks, a lot of those decisions were either reversed or backtracked, realizing, okay, maybe this is just like the flu, and maybe we don't need to close this down or that down. And I think people made some really good decisions after making the first decision, and I commend them for that. But where I struggle is we as a society still look to doctors and these professionals for advice. Mm-hmm. And I think a lot of that's gone out the window because of their willingness to, follow along or follow what they've been told. You mentioned the FDA mm-hmm. and the CDC and these other organizations that we thought were the end all.
Right.
And come to find out they're not. So how do we come back with confidence and get through this or anything else like this in the future? I mean, as a doctor, what would be your advice?
Well, I think that you need to find a practitioner that you're comfortable with,
mm-hmm.
and you need to find out and ask them, how they feel about these issues. I think you need to find people that are open to other opinions in their data search, because there's been suppression and corruption of data, and people that can't see that, I would be concerned about. So not to say that everything is, but I feel very uncomfortable with the conclusions that I'm seeing coming out of some of these issues, just like these masks. I mean, the standard cloth or paper mask is like trying to stop a mosquito with a chain link fence. Mm-hmm. So, I mean, and I've worn a mask in the operating room for 30 years. Mm-hmm. So I have worn it a while. We use it for droplet protection and bacterial blockade, but not for viruses.
Yeah.
So, that's one of the things.
Well, let me ask you real quick. So,
yeah.
As a doctor, you've worn a mask in the in the surgery room or whatever room you're in. All of a sudden, this mandate comes out to wear a mask. Do you just scratch your head and go, "Are you kidding me?" Or, I mean, how do doctors follow along with that?
I really don't. I didn't understand that. I went to a school board meeting last fall to talk about that when they were at Flathead trying to decide mm-hmm. what they were going to do with School District 5, and I basically said what I told you, that these things, they're not going to protect you. I mean, you're just basically, especially in the younger grades, we feel that a lot of the young children have had stunted speech and just emotional problems because they can't see mm-hmm. the person's face. And that is so important that they interact not only with verbal, but with facial expressions. They say so much.
You mentioned something about, meeting up with the healthcare professional and seeing what their points of view are before you select who that is. It's interesting because some things we just assume are accurate, are right, are the way they're supposed to be. And a constituent of ours, Rod Kuntz, his wife is a midwife, mm-hmm. and she's constantly on call. And my wife's going to this call. Wife's 43 weeks. 43 weeks. I said, wow, she's 3 weeks over. He's like, by whose standards? I'm like, well, the doctors always told us, with our two, that 40 weeks was the time. He goes, It's not the timing of the doctor's office that needs to schedule it so the doctor can go play golf that afternoon. It's the timing of the individual human being.
Right.
It might be 38 weeks. It might be 39. It might be 40, 41, 40. He goes, think about it. Okay. The human body does not operate on that perfect clock.
No, it
because
doesn't.
it comes down to dollars and cents and then being able to schedule out deliveries and all these other things. So, I mean, I know this to be true, but maybe you can touch on a little bit. There's a lot motivated by money as it relates to medical practices.
Yes, as like it's kind of the dichotomy in medicine. When medicine acts like a business, they say we should have ethics, and when we have ethics, and we do something that's ethical but is expensive, then they say we need to run like a business. And there is that push and pull. But yes, most people respond to financial incentives.
Yeah.
And I had one physician tell me that, you just have to follow the 4 A's if you want to be successful as a doctor. You have to be available, able, affable, and affordable. And if you can be those 4 things, then you will do fine. And I've followed that dictum pretty much throughout my career. People will ask for you. Somebody will mention your name. We always say that if you take good care of somebody, you'll get 1 other patient. If you don't take good care of somebody, you'll lose 10.
Yeah.
So, but as far as the costs, we've seen it in this pandemic, that the incentive to intubate people, to admit them, have a 5-day course of remdesivir, which is actually a relatively easy admission. If somebody's not really sick, but they need that 5 days of IV remdesivir, they keep them in the hospital. So that's 5-day hospitalization and a $3,000 drug treatment. That's a lot of money.
Yeah, and who knows what else they'll pick up while they're there for the 5 days. Well, look, I'm all for anybody making money. The more money you can make, hopefully the more money you can give back to the society,
Right.
Through goodwill. But I'm completely against, being mistreated.
Right. And just to build on that one thing, which would be the other thing that I wanted to focus on in healthcare, is that there are hospital and treatment charges that should be much more transparent. And we all have high deductible healthcare now. I mean, the deductibles are much higher. I'm in the individual market. I have a $7,000 deductible for my wife. And so we would like to shop. And I would drive down to Missoula to get an MRI of my back if I knew it was going to save me $1,000. But that information is not easily obtainable. And that's something that we need to work on. And because the federal regulations are there, but I don't think they've really pushed trying to get it out there.
Yeah, transparency.
Yeah.
You mentioned regulations. Talk about over-regulation for a minute. I know that's one of your platforms.
Yeah. Especially in healthcare, I mean, it's one obvious area, but it's amazing the amount of money that can be spent to become compliant with certain regulations. Like in healthcare, the example would be I open a vial of medication sterilely before the morning cases start, and then I section it off into 5 different patients. That is discouraged now. And even if it's an expensive medication, they say, you single dose. Everything's become disposable, single dose. And those type of regulations, they're through all the industries. I only know mine very well.
Sure.
But I do talk to others that have very similar concerns that I'll give you one of the most funny examples of over-regulation in healthcare anyway. At the Flathead Valley Orthopedic Surgery Center, when they came through and were approving our surgery center, that we have 2 operating rooms and a procedure room. And those were only accessed with nurse, physician taking them back to the room. But our room names did not have the name of the room in Braille. And there would never be a time that there would be a patient that, if they were blind, and I'm not making any fun, but that they would ever, and never, your circulating nurse or your physician or your surgeon, if they had that visual impairment, they wouldn't be practicing. So it's stuff like that adds to every one of the costs that we go through.
Yeah, I keep thinking about when you come out of the grocery store, there's those bumps at the curb. they drive me nuts, but they got